Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, impact of lockdown extension following presidential broadcast. Controversy in Benue State as suspected COVID-19 patient, as reported by the government, insists she's well. And figures of the coronavirus globally nears 2 million. That's according to Johns Hopkins University. Now, the figures are constantly on the rise. The COVID-19 situation in Nigeria is of great concern to all, the governments, the civil society, and every Nigerian. Figures from the Nigeria Center for Disease Control, NCDC, announced 20 new cases of COVID-19 yesterday, bringing the total number of confirmed cases in Nigeria to 343. 13 of the cases were reported in Lagos, 2 in Ogun State, 2 in Edo, 2 in Kano, 1 in Ondo State. But it is not all gloom, as Lagos State Governor announced that 6 more patients tested negative to the virus following their treatment at the Infectious Disease Hospital Yaba yesterday. So far, a total of 91 persons have been discharged and 10 deaths recorded. A breakdown of the cases in each of the states shows Lagos still has the highest, 189 cases, FCT Abuja 56, followed by Osun State with 20 cases. Now, concern is an understatement, as the president told Nigerians in a national broadcast yesterday that he is indeed worried by the rising figures of the global pandemic and also the figures in Nigeria. President Buhari said that it is sad to note that the deaths in Nigeria is now 10 compared to the number when the first 14 days of lockdown was announced. He then adds that government is building on the gains of the first 2 weeks and is extending the lockdown in Lagos, Ogun states, as well as the Federal Capital Territory for another 2 weeks. He also talks about the COVID-19 economic team and directs that the current social intervention register be expanded to include another 1 million households in the next 2 weeks.
As a result of the overwhelming support and cooperation received, we were able to achieve a lot during these 14 days of initial lockdown. We implemented comprehensive public health measures that intensified our case identification, testing, isolation, and contact tracing capabilities. To date, we have identified 92% of all identified contacts, while doubling the number of testing laboratories in the country and raising our testing capacity to 1,500 tests per day. We also train over 7,000 healthcare workers on infection prevention and control while deploying NCDC teams to 19 states of the Federation. Lagos and Abuja today have the capacity to admit some 1,000 patients each across several treatment centers. Many state governments have also made provisions for isolation wards and treatment centers. We will also build similar centers near our airports and land borders.
So to comment on our COVID-19 updates, India, France, among countries that have extended the lockdown, as Austria and a few others reopened shops. We have details in a moment. Welcome back. Still on measures to curbing the COVID-19 pandemic in Nigeria and across the world. Joining us right now is Dr. Michael Anora, an obstetrician and gynecologist. Thank you for joining us on the program.
Thanks for having me.
First, I'd like to get your reaction to what appears to be happening in Benue State and the case there, Mr. Doko. There appears to be a mix-up of information, or perhaps there wasn't enough sensitization because she seemed not to be satisfied with the methods in collecting information and then in the information itself?
Yeah. Okay. Thank you for that question. I think what we can observe is that from day one, she distrusted the state. So maybe there was some kind of communication gap, because when you are dealing with this kind of diseases, and already we're having people beginning to ascribe some kind of what do you call it? Stigma to it. Like if you have it, no, I don't want to have it. So there has to be some level of communication between the client or the patient, explaining to the person that no, it's not a death sentence. Most people will actually recover from it. And so communication has to be free and two-way, so that the person understands. I don't know how NCDC works or how efficient they are in sample collection to reporting the result. Maybe they're more interested in figures rather than the clients themselves, because a lot has to go into talking to the person, so the person is relaxed and can take whatever else is coming from you.
Another thing is, how much protocol is involved, because, this is also a very novel virus, and with the way it spreads, the government, I'm sure, are trying to be extremely careful and ensure that there is no panic or fear that such persons who might have gone to high-risk countries need to actually self-isolate.
Protocol is one problem. If protocol is normal, but if it takes too long or it becomes complex, it can cause some discrepancy in information flow. This is not isolated to Benue State. There's the incident in Anambra State where the first case there is also denying that he is not corona virus positive or COVID-19 positive.
Initially.
So there has to be a lot of efficiency from the NCDC part in managing information, especially as regards the client.
Let's look at the immune system. Have there perhaps been, research is still ongoing, but, if indeed the virus attacks a pregnant woman different from someone who isn't pregnant, are there more dangers because that's also put in the bracket of vulnerable persons and perhaps newborns as well?
Yes, in some of the countries that are being ravaged by this disease, they've put pregnant women, they've labeled them as vulnerable group. Not because there's they manifest the disease in any specific way, just because they are pregnant. From research or available evidence, there's no evidence to show that pregnant women manifest this disease in any other way other than how women in the general population manifest this disease.
Right, so that's it's nothing like that. So in terms of taking care, just as every person, a pregnant woman should wash their hands, wear the face mask.
In addition to that, apart from the regular infection prevention control measures, washing of hands and hand sanitizers, and other, pregnant women particularly must stay away from crowds, from large crowds, and places where people who are coughing or people who are manifesting these symptoms. The reason is not far-fetched. Pregnancy is a very, is a period of a lot of joy and expectations in the woman. But with all this pandemic, there's a lot of anxiety too. And we also know, as in those of us in the field, know that pregnancy, there are a lot of changes in pregnancy, especially in the respiratory system, that can make pregnant women, more susceptible to severe manifestations of viral illnesses in pregnancy,
like
from past
flu.
experiences, common flu, even the previous SARS infection in 2003, 2004, the MERS, and even the common flu influenza. So having that at the back of our mind, while evidence does not show that they don't manifest in severe form, but vigilance is the word. We have to be vigilant just in case because things are happening real time. Finally,
we hear that some hospitals are shutting doors to antenatal. Women who are pregnant need to go for their antenatal. This shouldn't be happening in this period, but they also need to be careful. Yes, it's quite unfortunate because antenatal care is an essential service because it has been shown worldwide to reduce incidence of adverse outcome in pregnancy and even in the newborn. So this is quite unfortunate. I think this would mostly happen maybe in the private setting because most government or public hospitals have protocols on how to attend to pregnant women during this period. So, but the problem the private hospitals are having still borders on one, information. Do they know exactly what is expected of them? Two, do they have the equipment, personal protective equipment, gloves, and all those things to manage or to even
screen, because not everybody that comes who has a fever, cough, is COVID-19 positive.
All right. We'd like to thank you, Mr. Michael Anora, obstetrician gynecologist. Thank you for joining us on the program.
Thank you.
Now, here are some of the precautionary measures some of the states across Nigeria are taking. Let's start off in Katsina State, where the government has directed civil servants in ministries, departments and agencies to continue to report to work from 10 o'clock in the morning to 2 o'clock in the afternoon on weekdays. A statement signed by the head of the state civil service explains that the directive was sequel to an approval by the state governor on the efforts to curtail the spread. It further requested civil servants to continue to observe the social distancing practice, ensure washing of hands in various places of work, and the use of sanitizers at all times. Kano State recorded 2 more confirmed cases of COVID-19, bringing the total number to 3. As said to the media, told our correspondent that the 2 positive cases are those who were in contact with the first index case. And the Infectious Disease Center in Ibadan is now ready to open its doors to patients who need treatment from COVID-19 infections, Lassa fever, and any form of infection that may arise in the state. The 100-bed capacity facility has been undergoing intense rehabilitation and expansion work over 3 weeks and is now set to receive patients from any of the designated isolation centers across the state. Over in Ogun State, orphanage homes, wives of soldiers who have lost their husbands during the national assignment in the northeast have been given food palliatives by the Ogun State government at an exercise held at the Stella Obasanjo Children's Home in Abeokuta, the state capital. The state governor, represented by the Commissioner for Women Affairs, said the gesture is to mitigate the challenges of the moment occasioned by the pandemic. Elsewhere, Ondo State is allaying the fears of people there following a confirmed case. An army officer who is said to have voluntarily isolated himself as soon as he arrived in Nigeria from India. According to the government, he is being monitored by the state's Inter-Ministerial Committee in collaboration with the NCDC. And the northern governors have met over issues relating to COVID-19 affecting the region at the meeting conducted via teleconference. Chairman of the forum, Governor Simon Lalong of Plateau State, said the forum resolved to enhance border control, surveillance, greater collaboration among states as preventive measures against the pandemic. Another issue before them was the federal government palliatives, which they say no state in the region has received a dime as special allocation, despite the fact they say that some states in the region have recorded cases. They're asking the federal government to grant them some special funds as done in other states. Now, it is day 1 of the second phase of the presidential lockdown order, and across the states, it's having a ripple effect. While the traders are complaining of difficulty in restocking their wares and items, it's the same complaints by pharmaceutical stores and food shops. Hunger appears to be biting hard at homes, as most people appear to have run out of cash to restock. Another dimension to this is that most youths who are idle at home are suspected to be engaging in different levels of cybercrime. But the Commissioner of Police, Lagos State, says security agencies are on top of the situation. And India's Prime Minister Narendra Modi has extended a nationwide lockdown till May 3. France extends a lockdown for another month. Italy and Austria have eased lockdown measures, and Prime Minister Modi extends its lockdown, saying that the announcement is coming amid debates in countries around the world on how to lift restrictions while avoiding a spike in new infections. And charged with protecting health of Nigerians, the NCDC Nigeria Center for Disease Control's website is live and has all the information that you need. Also, the guidelines on social distancing and indeed how important it is to stay at home this period. You can also access emergency contacts at this time. Same for the World Health Organization, with live updates each moment depending on what part of the world you're in. It keeps updating on the number of cases, the number of deaths, and the recovery efforts so far. Well, that's our COVID-19 update here on Channels Television. Another update comes your way at 6 p.m. Do join us then. Don't forget to tweet at us. Another lockdown measure in Lagos, Ogun, and the FCT. Let's find out how your social distancing and how your stay home is going. Tweet at us at Channels TV. I'm Millicent Walker. Bye for now.